Paris, among the most common long-term problems for survivors of severe COVID-19 is a persistent shortness of breath and fatigue. You might think that's because of lung damage due to the coronavirus, and that certainly does occur. But a new study has found that damage to the diaphragm could also be a major cause of those long-term symptoms. Joining us now to talk about that study is Dr. Colin France, a physician scientist at the Shirley Ryan Ability Lab and an assistant professor at Northwestern University's Feinberg School of Medicine. Dr. France, thank you so much for joining us. So you've done a study on patients who have long-term effects from having been hospitalized with COVID-19. Some of their symptoms include shortness of breath and fatigue, as we mentioned, poor sleep, but also headaches, feeling lightheaded, and a tingling pain. Most folks might think that this is an issue with the lungs, but your study focuses on the diaphragm. What led you to focus on that, and remind us what the diaphragm does exactly?
Right. Well, the diaphragm is the main breathing muscle. And when you breathe in, it contracts and it goes down, it pulls air into the chest. And the muscle itself can be weakened in a number of different situations, which I also take care of. But the reason we clued into it related to COVID was all the weakness we were seeing in other muscles after people who survived very severe COVID, went to the intensive care unit, ventilators, and this sort of thing, came to the rehabilitation hospital, like the Shirley Ryan Ability Lab, and they were weak all over. So it stood to reason that some of their breathing problems might be from the breathing muscle being weak itself.
And what did your study find?
So what we did, it's often hard to directly evaluate the muscle. And when someone's short of breath, we often think about heart, is the lung, is it something else? But using ultrasound, which a lot of people get familiar with when they have children and for other tests, but it's a non-invasive imaging test we could do at the bedside. We were able to look at the thickness of the muscle and how well it was contracting. And what we found very often in COVID patients, the survivors of severe COVID, was very weakened, poor quality muscle that didn't contract well.
So is this damage to the diaphragm, is this unique to COVID patients, or do other patients who've also had extended stays in the ICU, also been on a ventilator, have they had similar issues?
Yeah, so this was a great question. We started to get this data, and that question came up almost immediately. And we know, because we know that people after being in the intensive care unit, after being on a ventilator, do get weak. But we thought that this weakness that the COVID survivors had was out of proportion to what we were used to at the rehabilitation level. And in fact, when we compared them to a group of people we tried to match for intensive care unit stays and came to rehab, we found that the COVID patients had more severe muscle weakness, poor contractility, at a much higher rate than people who survived the ICU from other illnesses.
So is this kind of damage, is it permanent, or is it something that can be remedied with medication or therapy?
Yeah, if there's a silver lining to this observation, it's that although it's not in the published report yet, in our new set of data where we've been tracking people after they leave the rehab hospital, is that the vast majority of people are getting better. And we have seen that they do respond, this weakness does respond to rehabilitation and to training of the diaphragm muscle.
What would you say are like the most effective ways to help patients recover? What does that training involve?
Yeah, I think there's a couple aspects of it. The first part is, I think I've used the analogy, if someone has a knee injury and then starts limping, and then as time goes on, that knee injury heals, they still continue to limp because they've learned a new way to walk. We've seen that take place with the diaphragm, where people start breathing with what's called the accessory muscles, other muscles other than the diaphragm that can move the chest. And then what we need to do is first start to train them to start breathing again with the diaphragm, which is as it starts to work again, they need to start recognizing they can activate it. And then as they go on, there's building back the muscle strength and endurance, which we do through targeted exercises that actually activate and add resistance, or kind of weightlifting for the diaphragm.
Now, as the Delta variant spreads rapidly, we know very clearly that this pandemic is far from over, and there will presumably be more people recovering from sort of a long COVID symptoms. Are the insurance companies willing to cover the cost of this rehabilitation?
Well, I think that there's always issues with access to care, even before COVID. The biggest thing we've done on our side of things, both at the Shirley-Ryan Ability Lab, Northwestern, and other hospital systems across the city and the country, is try to build a comprehensive post-COVID clinic, which ideally works together so that you can see the specialists you need for the ways that this can affect many different parts of the body, and then make it easier to navigate the system. Because one of the hardest things is you've got a multitude of symptoms and you don't know where to even start getting help.
And you just mentioned, probably some sort of more comprehensive clinic, because this study was done on a relatively small group of patients. What's next for this research? Where does it go from here?
Yeah, well, the lag time between research being published and what we're actually doing. So we've scanned more than double the number of patients now. And I've also expanded to study people who were quote unquote long haulers, the people who had COVID but weren't so sick that they needed to go into the hospital, or certainly didn't need to go into the intensive care unit. And so this work in terms of understanding what impacts quote unquote milder COVID may have on people and their breathing, because shortness of breath, and particularly shortness of breath with exertion, like daily activities or exercise, is a very common after effect of COVID and long COVID in patients who, even if they weren't severely ill. And then the other aspect is, do people get better and do they respond to our treatments? Which, kind of is one of the struggles, is we're trying to figure it out as we go along and incorporate all the new data on COVID. But we're finding some good reason to continue with these exercises, because we're seeing many of our patients are getting better. In fact, the majority do after severe COVID, which is reassuring.
Okay, then we'll keep an eye out for further research and information from you. Dr. Colin France, thank you so much for joining us.
Of course, thank you.